Welcome back. Our final panel session is to discuss the question, implementing the NIH data management and sharing policy. Are we actually ready for 2023? I think from what you've heard, there are many things that need to be done in order to actually be ready. And so we've taken a number of panelists and a few people from who have not spoken so far to go over and think about what you've been hearing for the last 2 days. And we've asked them, in the light of the common themes and takeaways from the earlier workshop sessions, explore the possible challenges to the implementation of the NIH data management and sharing policy from a variety of your stakeholder perspectives, and consider possible actions that can be taken to help different groups prepare for and be successful with complying with the NIH data management and sharing policy. You can see here that our speakers will be Christine BORGMAN, Distinguished Research Professor, Information Studies, UCLA, Philip BOURNE, Founding Dean, School of Data Science, University of Virginia, SUSANNA-ASSUNTA SANSONE, Associate Professor of Data Readiness, Associate Director of Oxford E-Research Center, University of Oxford, Margaret Sutherland, Program Manager, Chan Zuckerberg Initiative, Neil THAKUR, Chief Mission Officer, ALS Association, and Leticia WYATT, Assistant Professor of Neurology at the Oregon Health Science University. We'll just start in order, asking each of these to speak a few minutes about their ideas, about what they've heard and their suggestions. And then we'll move into a group discussion and take questions. So Christine, please go ahead.
Thank you. I've got a few slides here. The first takeaway is, my perspective is I'm a social science, sociotechnical researcher who's been looking at scientific data and data practices for more than 20 years. And I'm struck over these last 2 days at how little the conversation has changed in terms of the incentive structure, the carrots, the sticks, the economic trade-offs. Many of those things you had heard a very similar conversation in 1998 or 2002 of what we've been hearing today. So I want to focus on why that is and how we might change that conversation going forward. The central theme is that we need to think more broadly than we have about knowledge infrastructures. And this is a term that's come into vogue in the last 10 or 15 years. I've put up covers of 2 workshop reports funded by Sloan and National Science Foundation that have brought together stakeholders from a number of different disciplines to think about these issues. But generally, the idea is that people exist, particularly scholarship exists, in this broader set of robust networks. It's people, it's artifacts, it's institutions that come together, and we generate, we share, and manage different kinds of information about the world around us. Now, another thing to point out is that infrastructures are everywhere, but no one is really in charge. They're organic, they're evolving. There's a lot of chaos involved in all of them. So that leads us to the challenges of implementing the NIH plan, is that there's been an excessive emphasis on the individual researcher, the individual PI, as though all the weight should be on that person's shoulders, where in fact, we need to think more broadly about this embedded nature of those data and the data practices, and stop thinking about data as fungible entities that we can count. Yes, we need more data about data sharing, but we need to recognize that the data are embedded in the expertise, the methods, the protocol, the software. Often, if you don't have the software and tools, you don't have the data. We need to get more of the curators involved. We need to invest in all of these different pieces of the infrastructure and recognize the practices involved. I was struck both by Danny Goroff's discussion around the economic frameworks, the number of people willing to work more in those areas, and how we tend to think about these not clearly enough as whether they're rival goods or public goods, for example. The legal and ethical frameworks, where we heard from people like Anita Allen that the way we think about data sharing in fair information practices is very different than the way we think about it in the FAIR principles. So bringing those things together and recognizing that it really takes a village to manage and share data equitably, fairly, economically, and effectively. This is a slide that I just brought back in from Irena Pasquetto's presentation earlier. And she focused in her presentation this morning on the work from her dissertation in biomedicine, where she studied a large NIH-funded consortium whose goal specifically was data sharing. But in this paper, we compared those data that she got within the last 5 years or so with data that we got earlier with my team from about 2002 to 2012 in Earth and Environmental Sciences, and had a very parallel set of findings that the comparative data reuse was common. People did go and find other data to do things like ground truthing a physical site. How wet, how dry is it? What are the elevation considerations? They need them to calibrate things. And it's a fairly routine practice, kind of like doing a literature review, they would do a data review. But the occasions when people were really able to get somebody else's data and use them for a novel purpose rarely occurred. It was sometimes once or twice in a career that people really tried to do that. It's a very complex process. One of the nice little snippets out of Irena's dissertation is she found that the metadata that investigators often most wanted in reusing somebody else's data was the phone number of the PI. And that's metadata you just don't find anywhere. Okay. So that personal relationship is what's not embedded when you think about data as fungible resources. So I think to improve success, we should take a much broader, more knowledge infrastructures approach and focus less on the individual PI. It's investing in that curatorial expertise. We've heard about this, but we need to get the universities to invest in that curatorial expertise and make it available across the university. Similarly, we need to think about funding data repositories, not in 2 and 3 and 5 year grants, but coming up with something, as we heard again from Danny Goroff, that the data repositories are themselves expensive, and it's very hard to find ways to fund them. We need economic considerations. The graduate training and research methods tends not to be very specific about protocols, much less about data management. Software sustainability is a massive problem throughout all of the sciences and technology, and it's one that really has not been very much mentioned today. The technical infrastructures, we had one presentation that talked about moving from data downloading to data visiting. And that we need to, for example, be thinking of as well. So we need to assess our progress with other kinds of socio-technical studies of data practices, the kinds of things we and others have been doing, where you do case studies, you do more ethnography, you really see what those data are on the ground. Some of those informetric studies where you can do bibliometrics, looking for where the data show up. And then thirdly, to do those kind of econometric studies that we heard about for the cost benefit, find where those numbers are. And again, those are going to take a lot of deep dives. Those are not going to be something that a survey is going to get. So let me stop there. I hope this has laid a few things out that we can continue to explore in the discussion as we move along. Thanks for the opportunity.
Oh, Phil Bourne.
Yeah, thanks, Richard, and thanks for the opportunity to say a few words. I don't have slides, which means you have to unfortunately look at my face for the next couple of minutes. So the question is, are we ready for 2023? I think it's a question that the NIH should be asking itself, and that's really the focus that I'll put on this. And I think the question is better phrased as, I don't know if you know the answer to that. The answer is probably no, but can we be more ready? And I think we can indeed. And here are a few thoughts about that from my own perspective now, which, like Neil, as he spoke before, has been on the inside of the NIH and now is on the outside and can say what they want. So it's an opportunity. And I also speak from the point of view now, really, as a university leader, looking at what the implications are for what's proposed. So the challenge that as I see it as an administrator, it would be pretty much put in a cynical way, this way, namely a proposed R01 investigator comes to me and says, this happens frequently, they are making me jump through these bureaucratic hoops when the reasoning and the value is not clear. My time would be better spent doing new research. So what's the response to that? And I think there are some solutions to that. And I think what it requires is actually what I would suggest is a cultural shift within the NIH itself. So the policy is just really a sort of set of guardrails, if you like. So it's really working more across the 27 institutes and centers to illustrate that the policy is simply the guide. And what is actually happening is what's important, not what you're actually trying to enforce. So that's easy said. What can be done? Well, here's a few ideas, at least, that some of which have been touched on in the last yesterday and today. And to be fair, a lot is being done already. And I think we should give the NIH huge amounts of credit for how they've driven a lot of aspects of open science over the years. So please take this the right way. I was thinking about training grants themselves. Training grants come from all over the place within the NIH, but they don't necessarily, I don't think the call for proposals even specifically talk about pedagogy around data sharing and beyond. So in other words, actually giving awards of training grants where this kind of training of data sharing and what it means and actually developing tools and everything else that goes with data sharing is actually adopted within the training itself. The next generation, I think, are critical for this adoption of what we're trying to achieve here. So training is obviously the place to start. And I'm sure we'll hear more about that momentarily. But and I think the simple acknowledgement, and when I say data, I really including methods, protocols, software, etc., are really foundational infrastructure for biomedical research. And we need to be doing more, we being the NIH need to be doing more to foster that sharing that's beyond policy. And I think ease of compliance will come from really innovations that measure innovation itself. We've heard a lot about how hard that is to do. But there's a lot of very smart people out there, and in fairly simple ways, new innovation for actually measuring innovation with respect to data sharing can come forth. Prizes, hackathons, and these kinds of things certainly lead us in that direction. We heard from Paddy yesterday about RADx, but what we really need is a RADx. So RADx being a public-private partnership around early-stage drug discovery, we really could do with the same kind of thing for how we think about data sharing. Approaches that leverage this public-private partnership. And then I think more purely around the notion of research into data itself, particularly across domains in an interdisciplinary way. I think too much in the past has been left to the small funders, as we heard a little while ago, and also frankly, to the foundations. It's much of the work in scholarly communication has been left to foundations that relative to the size and resources of NIH is pretty limited. So I think the idea of cross-pollination of grants that actually really get to tools and capabilities along the lines of many of the things we've discussed how we, cross-pollination with other disciplines and other approaches, and funding that for its own sake in bigger ways than happen now would be really worthwhile. Beyond that, I think it's also important to say we're undergoing a digital transformation of society, and this innovation around data and data science is everywhere. Data science initiatives in academia are popping up like mushrooms after rain, and they've been accelerated by COVID. I think more of what's going on there, where healthcare and biomedicine is one vertical across what those initiatives look at, could actually, a lot could be gained from that in terms of certainly workforce pipelines and all sorts of opportunities to foster better data sharing from the innovations that are coming out of these data science initiatives. And then the last thing I'll say relates to stakeholder focus. I like the notion that was brought up yesterday that resonated with me, with this idea of concentric spheres of influence. We right now, certainly the panel and probably a lot of the people listening, are already the choir. And what's always worried me about these initiatives that go back a long time is we're preaching to the choir, and how we actually build out this sphere of influence. And it's gradually picking up evangelists as we go, I think is something we really need to think about. Institutional libraries within the university framework are good examples of stakeholders and have been real players in all of this, as we've heard something about. I think where we haven't really, frankly, influenced enough is the leadership within universities, vice presidents for research, deans, provost presidents. I think outreach is needed, and training sessions are needed for these folks as it relates to data sharing. I mean, recent report from the Association of American Universities and the Association for Public Land Grant Universities, I think, point the way to actually doing this. And I think that kind of outreach from the NIH would be most welcome. I mean, being one of these folks, I can tell you we're very consumed with worrying about just getting students on campus during COVID or after COVID. But attention, our attention needs to be drawn to these important endeavors, which, in public and, well, all universities, it's absolutely part of the mandate. And then very lastly, I would say there was issues brought up about citizen science as scientists as stakeholders, particularly as it relates to legalities and so on. And I appreciate all of that. But I think there's huge opportunity in a changing world to bring citizen scientists to bear onto various projects within the NIH that, of course, would then expose them to data sharing. I speak just as an example. The All of Us program brings in participants at the beginning of the process and then offers them something at the end, but it doesn't really expose them to all of the work that goes on in between, which could easily happen and would, in fact, expose them to the general public to the notion of the importance of data sharing, which frankly they're just not aware enough of, which then puts lots of pressure through Congress and so on to actually move the process forward. So those were my thoughts about how things could go in the future, and I'll stop there. Thank you, Richard.
Okay, thank you for SUSANNA-ASSUNTA SANSONE. I hope I pronounced that correct.
That's correct. Thank you very much, Richard. So I am a PI whose research subject is research data management and data sharing, and has been for the last 20 years. To be honest, how I have progressed in my career, it's a mystery to me too, since research data management, it's not a recognized subject and there is no career path or a clear career path. I can tell you that being a PI in research data management as a subject, it's like being on a perpetual diet where you eat little but often to be able to survive. So let me try to give you my views on the policy, the NIH data sharing policy and implementation and the challenge and etc. I have 3 points. My first point is any policy is only as good as its implementation. And we know that designing a good policy is one thing, implementing it's another. Policies tend to be very often aspirational documents, tend to be a little bit out of touch from the daily research and the example, tend to be often too vague. because they try not to be perspective, and they tend to be too flexible. And I'm not sure that really means that they become a driver of change. And even if you are a capable group or a capable organization, such policies sometimes really are perceived as tick boxing exercising because they are vague. And that's really leads to something which I call compliance fudged. You know, you can fudge compliance. And compliance to policy doesn't just happen, even if you have an asserting policy. You know, you don't know if it's going to happen or if it can happen. Point two, compliance require whole hands on deck type of approach. And we have heard this over and over, starting from Patty Brennan on day one, where she said that data management, research management, data sharing, it's a team sport. We heard it's a partnership among a number of stakeholders. Now, without support from institutional level, as Christine already said, or by community framework and implementation, these still remain a challenge and remain an exception rather than becoming the norm. So we all know that we need to involve the researcher at all levels, from the underground to the grad to the PI, but we also need to involve the professional and make sure that the professionals are empowered and are participating in implementing this policy. Here we're talking about from the research software engineer to the librarians, any service provider, publisher, let's not forget about them, society, alliance, academy, in the commercial, in the academic, in the governmental setting, and obviously the funder themselves. Point three, policy need to go hand in hand with, I wanted to say practice, but I will say funding. So the NIH funding programs are the instrument to enable the implementation of the NIH data management and the data sharing policy, as well as an instrument to incentivize the uptake of the policy. So we all know that we need the technology, the social infrastructure, the culture, the policy change, the education, the training element, and often we know very well they're not well funded, and Phil already gave an example. So we need these things, but sometimes these are expected to magically appear somewhere, somehow. I would like to see more funding program that really allow all the stakeholders from private and private sector, and Phil mentioned the private-public partnership, very key, to come together with this in multi-partner projects, very much along what's happening in Europe. There are these big, huge projects. I would like to see more funds in three areas. So the first one, it's enabling science, obviously, because we all say that, we need to show, we need to lead by example. We need to show example of how this good infrastructure and good practice lead to accelerating the discovery. But we can do that through projects that actually showcase the application of production level system, this building block of the research data management, the tools, the standard, the infrastructure, the professional that put those in action, and see how we can really accelerate discovery by secondary analysis, accumulation of evidence on everything that's been mentioned very much on day one. Another type of funds and project I would like to see funded, the NIH, are those around improving the research practice and the culture. So we all say that we need to transform the research culture, which is the environment in which we do research. And we need to improve the practice, which is how we do research. So let's put projects in action that really shows the open science and put research data management as first-class subjects in this activity. And, we can leverage initiative like DORA initiative, like the FAIR movement, and to really explore better way to define and promote the career path of those people which enact this instrument. I would like also to see more research on research projects. In the previous session, we heard that we don't have enough data on data sharing. Well, let's build this evidence on how we can improve the efficiency and effectiveness and fairness of the impact on research of research data management. That's a research on research activity. Then the third type of project I want to see funded, it's obviously advance the technical sides of the research data management, the theoretical part, because we need novel methods, we need the new framework, we need new tools, we need to connect existing tools, and we need this activity to be funded. So perhaps what we don't need, it's yet another coordination project. Sometimes those become echo chamber. Phil was saying, we preach to the choir. And to be honest, I actually wrote a blog with colleagues a couple of years ago on the layer cake of fair coordination that is happening in Europe. And I'm not saying that these coordination activities shouldn't happen. They are good, but we need also to understand how to put them better in practice. Coordination is important, but I think we should make sure that there is no profusion of coordination just by adding another layer to this cake, because that's not the right solution. We think that we put another layer, maybe it's a sweeter way to bring the ingredients together, but actually what we find is a very sticky cake. Let me close by saying that in research data management, data sharing, the history is the future. And the future of the NIH policy, whose scope is to advance science, strongly depend on two things. First is that research data management data sharing becomes a recognized research and development subject. Second, that research data management data sharing infrastructure become invisible to the user, but not invisible to the funders. Thank you.
Thank you. Now let's go to Margaret Sutherland.
Hi, and thank you, Richard, and thanks for the invitation to participate in this panel. I'm a program manager at the Chan Zuckerberg Initiative. CZI is 5 years old, so we have a lot of learnings as we're going. And I thought maybe to share our learnings and how they fit with what the committee's been looking at. I'd start first by saying that at CZI, we believe in carrots. And so cultural change is driven by our learnings from communities we support. And basically, the key is understanding pain points in data sharing, code sharing, and then providing support to help labs overcome these pain points. And so one pilot solution we're trying right now is, can we provide a data concierge, that type of support to help labs find solutions? And then for the solutions that we're finding, we're looking for ones that can be scaled. So if you can scale a solution, you'll have a bigger impact on a broader community. We've also learned from some of the initiatives that we fund that data generation platforms scale faster than data management solutions. And what I mean by that is that usually, or we've seen that data management solutions for these new data, like single cell data, for instance, are often not part or supported as robustly in the science ecosystem. So it makes it very challenging for the community to keep up with data sharing. And what Christine said is true. Data alone has limited utility. So without protocols that address data generation, QC, analysis, include the code, and other metadata that's important, reuse of data is compromised. And I think another thing that we've heard is, where does cultural change begin? And I think Leticia is going to address this, but certainly we believe support for training and also implementation is key. So training support around data sharing, data management are key for students, postdocs, and staff scientists, because they're the next generation that we're looking towards. But it's also key not just to train, but also to create opportunities to put learning into practice. And I think that's what Phil mentioned too. It's really important to think about out-of-the-box solutions for really moving this forward. And another thing is, so what should one be thinking about for policy around data sharing to be implemented? And so I think we've heard about it, but maybe not necessarily found solutions, is that you really need metrics that will help inform data users, grant reviewers, and funders for decision making. And so there are examples where metrics really help and have helped us. So for instance, if you're looking at code, if you go to GitHub, you can actually look at, statistics for how a GitHub repo has been used in terms of number of users, branchers, tags. And that's a community effort where community can come together and share back and forth in terms of problems they have and solutions they're looking for. And I think I heard this in discussions today or yesterday too. Protocols.io is another platform where, again, you're supporting detailed protocols that aren't covered in journal publications, but it's really helping support reproducibility and robustness in the data generated. So, and on the Protocols.io platform, again, you can track downloads, forks, and you encourage comments from the community. So there's a learning from each other. So you're building that community again. And so I think a question is, what can we do to support communities of practice around data sharing? And so maybe the final thing to mention is that this is maybe a little more controversial, but advances in technology contribute to the evaluation of data value. And it really gets to, how do we build a data ecosystem that's sustainable. And I think we need to figure out what the metrics are going to be fiscally responsible for data management. So if technologies come about where you can generate more in-depth data or unbiased data than you could 10 years before, then that should be a metrics for retiring data and then moving to the next data opportunity. So those are some of the things I wanted to share.
Quick question. How successful have you been so far in getting cooperation and data sharing within your community?
So we're pretty new. We're 3 years in, and I think what we're at the stage of is really figuring out what the metrics are going to be. But I'd say we've been successful in our open science efforts, and so supporting preprint servers so people can share data earlier has been one thing. The essential open source science or software program we have supports code development and that. So I think we're still in a learning phase, but I think if you can create the community, you can actually build the practice. So,
thank you. Neil Thakur.
Yeah, thank you, Richard. So I think to answer your question, is NIH ready? I think by the literal policy where they're collecting data management plans and then the IC is overseeing the execution of that plan, they're ready to do that. It doesn't take a lot, but I think what was clear over the past 2 days is to do that well is extremely complex and requires an enormous infrastructure, lots of people who aren't directly impacted by the policy. And I think we can go into great detail and spend lots and lots of resources to do it well. And I guess there's a few things I'd like to say about that. So the first is, I would really love for the NIH to focus on not on what other groups can do, but focus on what they can do themselves. And so how can they use all of their processes to support data sharing, not just the requirement of the form itself. And I talked about some of those and others have as well. The second is not to leave out the NIH staff. I think they're critical to making the policy effective, or just keeping it as a paper collection exercise. And the NIH staff are different because they come from different disciplines, and every discipline has its own particular culture and drivers. And then there are institutions that have particular cultures and drivers. And so that complexity needs to be addressed. And I think through all of that, and what I didn't hear, I think, enough of, is the reason why we share our data. And it's not, we don't have this policy to share data. The success of this policy is not that a lot of data are shared and we have so many terabytes of data available, but that we're advancing science in a way that, in the NIH's case, drives health. And if NIH can keep their focus on that goal, and they can find ways to document that, even if it's through case studies, but ideally through some systematic efforts that an individual scientist is relevant, it can make it relevant to their own work. If we can take this policy and turn it into something, a set of actions that is consistent with the values of why people are in the fields that they're in, as opposed to the thing that's maybe most interesting to them that they could be studying, it would, I think, make this much more successful. And so I don't want us to lose the real impact and the real value of doing this in all of the process and details. So I'll stop there.
Thank you. And as the anchor run is from Leticia Wyatt.
Thank you. I have a couple of slides, so I'm just going to go ahead and load those really quickly. I'm so excited to be a part of this panel again and to be able to continue the discussion with you all. I really want to kind of, as we close out the workshop, propose that we engage with each other on the importance of equity as foundational to all that we've discussed over the last couple of days. During the workshop, I've noticed language like data is power, data are assets, return on investment, citizens, scientists, creators, owners, users, knowledge. And I really want us to think about how equity influences or impacts these different modes of thought. When we're talking about data as power, assets, really kind of thinking about the stratification of power and the stratification of assets that might exist, a return on investment. What are our metrics for this return, and who's kind of setting those metrics up in the first place? When we're talking about citizen scientists, creators, owners, users, are we being inclusive of everybody, really? And for knowledge, how are we, who's determining what knowledge is worthy and how that should be shared? And so I really want us to reflect on our conceptual frameworks and how they may be limited by oppressive and exclusive values that are inherent to the scientific enterprise, and how these might show up in our work. So what we should be always asking ourselves, our colleagues, our institutions, agencies like the NIH, what is the impact on communities of people who have been excluded by ethnicity and race? And this spans from the public, the general public, populations of patients and study participants, all the way through researchers, who the PIs are, their trainees and their support team, and all the way up to leadership, folks who we consider our decision makers. Equity concerns and issues need to be addressed as foundational to data management and sharing. Some of the challenges that we've talked about in depth for some of these over the course of the last couple of days, I just want to lay out here things that I picked up. So for one thing that I think that needs to be called out is the ability as a challenge, the ability for well-represented individuals to adopt it and to apply an equity lens. We all need to acknowledge and recognize that this is relevant and very critical to the scientific enterprise and the work that we do. Another challenge that I've noticed is partnering with peer. I'm going to continue to use peer, which again is persons excluded because of ethnicity and race, but partnering with peer communities and as patients and study participants. How are we doing that in a culturally aware and sensitive way? I also want us to kind of think about the challenge of resource availability and access. We know that funding disparities exist. And so this is something that we have to consider when we're talking about access to resources in order to execute the new guidelines or plans. And then we also need to be thinking about who we're training and how we're training them, who's involved in that, and who are we kind of allowing to participate in this process? And are we embedding equity and the culture that we want to perpetuate into our training process? A final challenge that I pose is representation and leadership in decision-making roles, and really for us to think about whose perspective is missing. Who are the people who are saying what's worthy of being curated and what's worthy of being shared, who are making these decisions about criteria for things like promotion and tenure. So I'd like to think about this as kind of like where we are and where we're trying to go. And the culture change it's going to be an evolutionary process. It's going to take time. And so what we have to recognize is that our values and beliefs drive our behavior, and our collective behaviors set the culture. And so we are in this process of basically recalibrating norms, right, that define our culture. And while we're kind of waiting for this to occur, what we can be doing is establishing guardrails and safety precautions, in essentially policies and standard practices that we can put into place while we push forward for culture change. So some considerations and solutions that I want to put forward. Firstly, I think one of the primary places where we need to focus intensely is on outreach and understanding of the relevance of equity in this work and the acceptance of the problems, in particular by those who are part of the well-represented group in the scientific community. Folks from these well-represented groups need to be able to adopt an equity lens. It's critical for the work, but requires much unlearning and relearning. And so we have to account for the time that's needed and the focused effort that's needed there. I also want to think about how we can be more proactive and intentional in building authentic partnerships with peer communities. This came up earlier by a previous speaker, but trust is earned and it takes time. And it's we can't have a partnership with these communities without it. So I propose that we adopt a strategy of talking less and listening more and following their lead and getting comfortable with the idea that folks in these communities, in particular peer communities, are the experts in the context in which we are trying to engage with them. We're not always the experts, so we have to be mindful of that. One other aspect I want to say about interacting with peer communities is the idea about credit. And we have to think about our history of stolen labor and its stolen information, how that's happened historically, how that continues to happen today. And when we're engaging with peer communities, we need to acknowledge our failures in the past and providing credit where credit is due, and making sure that we're properly attributing people from peer communities in their partnerships with us. I would also like to propose that we think about ways in diversifying leadership and increasing representation in decision-making. Again, we can do this across the entire spectrum. We need to be doing this across the entire spectrum, but it's really, really important for the decision makers because we need to redistribute power and resources. It's just something that has to happen. Basically, we need to make sure that representative perspectives and voices are incorporated at decision-making points, and a redistribution of power and reallocation of resources is a hard but necessary thing that we have to do. Building in transparency in how we do this as far as making decisions also goes a long way with establishing trust with peer communities. This last point is about how we can invest time and money in reforming our policies and practices, which are essentially our operational infrastructure at the lab level, departmental level, grad level, universities, and federal level. This ties back to diversifying our decision makers. We want to make sure that people who have perspectives that could lend to creating reform of these policies and practices are at the table so that we avoid unintentional harm to the communities that we're trying to support. And then policy reform allows us to standardize our practices, but we also need to always be thinking about how we're building in the accountability. We kind of hit on this earlier, but accountability, I want to make the point, we need to be building in accountability that matters to the stakeholders, and we can't exclude our peer communities as stakeholders. So what kind of accountability matters to those folks? Again, across the spectrum of scientific work. That's all I have. I'm happy to continue this conversation with questions. Thank you for letting me speak.
Thank you. I'm going to open it up so that the current panel can address issues raised by each other or ask questions. In the meantime, I will check with the chat room and audience questions to see if there's anything that we'd like to introduce from there as well. Just speak up, please.
I guess this is Phil. I would just say, with respect to Letitia's very important comments just now, I kind of trying to merge what I was saying with a lot of what she was saying. I think there are programs. So in other words, it's from my perspective, it was NIH doing more to foster a culture that's going to make data sharing easier. And Letitia was focusing on that, but also the need to be inclusive and diverse and really be equitable in all of this. So I think the idea that the NIH started the first program, and I think that's an example where there could be some emphasis that sort of merges gives opportunities around that particular program with the kinds of things that Leticia was talking about. At the same time, there's a lot of work now within academic medical centers to address some of the inequalities. And that's coming in various forms, particularly through, for example, our School of Medicine just hired a Chief Diversity, Equity, and Inclusion Officer. And I think, how that person is made aware of the importance of data sharing and how it affects the communities differently is something that, I think leveraging those kinds of new people that we didn't have before is one way to go.
Power and trust is so unequally distributed in this country that it's really hard to figure out how we can correct this. I think part of what Leticia is saying about redistribution of power, when we've just seen elections in which seem to worsen the distribution of power, even with a democratic administration, is, I think, a struggle that we're all dealing with and facing. But I'll let other people speak.
Richard, if I can take that, even step it back further to looking at the equity issues in what data we collect in the first place. And I think it really opens it up into a different lens of, it's an infrastructure issue. I pasted into the chat a very good book from a couple of years ago called Invisible Women, Data Bias in a World Designed for Men. And there's a lot of health issues in there, but it's got amazing examples of things like development efforts after natural disasters, where they rebuilt entire communities without kitchens, because they never asked the women who actually did the work in the process. And it's just example after example. And this book has won awards in finance and in business communities because it really looks at cost benefit analysis in different ways of, who are you asking in the first place? And I think it's, as we went around testing for the COVID vaccines, the fact that we tried to get a much broader than usual base of research subjects, that's the kind of thing that will help us open our eyes in that entire path of what those data are. And as Phil reiterated my point about we need more research about the notion of data in the first place, and that would take us all the way through this entire path.
Others? I'm struggling with allergies right now, so I'm turning on and off my mic. So as far as I can tell, the audience questions have not been coming in, or my audience question list is not being renewed. And I haven't seen any new questions in the chat room.
All right, I'll ask mine because my dog was barking, so I had everything off. Leticia, this is fascinating, and I'll be honest that HRA has our own database of funding, but we don't consistently, coherently collect the data that we need, even on funding. And one of the reasons is what drop downs do we use? It's race and gender and identity, and so I think that's part of this data, and it's the broader topic. Collecting data consistently and thoroughly would be really important. And I think that's, someone else said, yours is a kickoff for a future discussion. I think it is. We need to work together to have this data interoperable and reusable as well. I mean, I don't know if you have any thoughts on where we go to learn how to do that well.
Yeah, I think that's a really great question. And I know that that's something that a lot of folks grapple with. One of the things that I think a lot about, firstly, is what data do we kind of prioritize. And, you know, we always are trying to kind of think about quantitative metrics and putting people into buckets. And I feel like we, as a scientific community, need to really think about the importance of qualitative data, and figuring out how to leverage a lot of that information that may be available to us if we kind of engage in more conversations with a community of people. And so that, I mean, that takes time, that takes work, that takes trust. And so, I mean, I think it really requires just a lot of focused effort, you know, and planning, and all of the things that we kind of talk about as far as like the importance of data management and sharing and forethought and planning all go into this mindfulness about equity. And being able to have an equity lens is a skill, and that's not one that we all have readily, that we know how to kind of adopt. That's some of the work that I'm doing at OHSU, is kind of trying to help people learn how to adopt an equity lens. And so without kind of some of those prerequisite things happening, we can't really do the more meaningful work. And so, I mean, I think that these questions would be great for like a future conversation and things we should continue talking about.
Okay, well, thank you very much. I think we will let Leticia have the last word, and then move on to Marianne and a discussion of reflections on our meeting. I think this has been terrific. I got a lot of new information here for myself, and I think NIH will be very appreciative of our product. Thank you.